6:46 is the time. New this morning, local perspective on a concept we told you about earlier this week on Daybreak. 3 new studies show an aspirin a day could actually harm your health. According to the findings, the people who took low doses of aspirin daily did not necessarily benefit over those who took a placebo. Researchers also found people who took it daily had a higher chance for bleeding and major hemorrhages. So we have Dr. Noel Dasgupta with us this morning from IU Health to get a cardiologist's perspective on this new research. Good morning. Thanks so much for coming in.
Thanks for having me.
Absolutely. And this is going to be very helpful for everybody that's, okay, now what am I supposed to believe? Because every time there's a new study, it generates these questions. Is aspirin something that you often suggest patients take?
Aspirin is an important medication for patients with cardiovascular disease. What's important to realize is that if you have known heart disease and you've had blockages in your heart arteries or coronary artery disease, aspirin is still a key medication to use. This study looks at asymptomatic patients without risk factors for heart disease, and it specifically focuses on individuals that are over age 70 if they were Caucasian, or 65 if they were Hispanic or African American. Now, in this age group, in patients without known cardiovascular risk factors, they didn't see a reduction in cardiovascular events, nor did they see a decrease in the incidence of dementia or freedom from physical disability. What was also concerning was there was an increased risk of bleeding, which we know about. The most common things with aspirin are bleeding from the GI tract and more rarely bleeding in the brain. Also, there was a small increased incidence of cancer in the patients that were taking aspirin. That we still need to learn more about because there's other data that has shown that aspirin may actually decrease your risk of cancer, so that's something that needs more investigation.
Okay, so aside from that though, this doesn't really change your views on aspirin and how to go about that?
Well, I think in the past, sometimes we've told older individuals aspirin should be used as a preventive strategy.
Yeah.
We wouldn't use it just to prevent heart disease in patients who don't have risk factors for coronary disease. So we wouldn't tell everybody to take an aspirin like we did in the past.
Okay.
So only those with known coronary disease or blockages in their heart arteries or who are at high risk for heart disease would be the ones that we would recommend an aspirin.
Okay, so some evolution of thought then with this. What are your suggestions for anyone who is wanting to maybe avoid aspirin?
That is a great question. So the first thing is always to talk to your doctor and see how you fit into the study criteria. You need to look at the patient population. Other things you want to do are, of course, maintain a healthy weight. There's some concern about which is the most appropriate diet strategy. More people are doing lower carbohydrate diets. So far, our evidence shows that probably a moderate carbohydrate diet is something that will help you live the longest, but I think we still have more to learn about that. Also, you want to exercise. If you have diabetes, you want to make sure your diabetes is well controlled. And any other risk factors you have, like high blood pressure, you want to make sure that's controlled.
Good thoughts, and such good timing too, because we, of course, are talking about high, low carb diets in one of our news stories today. Nina's covering that for us. So we said the line already, everything in moderation, right?
Yeah.
Dr. Dasgupta, thank you so much for coming in and spending some time with us.
Better
understand this, Scott and Randy.
Randy and I are over here taking notes.
Yeah.